Once it bites and it stays 30 minutes inside, it is going to, of course, get really full. So this leech might get the size of my thumb, for example. And then what's gonna happen is it's gonna crawl right back out. So no danger of the leech getting lost inside. There's no danger of the leech biting you in all the wrong places or doing anything wrong. It's not that difficult. It's not that dangerous. It's really not. Leeches do love open, exposed areas. And if you watch my video on where I put a leech inside my mouth, leeches, 3 leeches, they immediately bite because it's a well blood supplied area of your body, so it's the inner lining of your body, so the leech is gonna love it. It's gonna bite right away. Once it's done sucking from the inside of this this little setup, from the lips of the cervix, it is going to crawl right back out. So if you keep this open, the leech will come out through this opening. If the leech doesn't come out, even if you close this, okay, if you take this out, you say, okay, I'm tired of this. I put, say, 3, 4, 5, or 10 leeches inside. I don't want to have this keeping me open like this. And then you pull it out. Even with that situation, and when the leech is inside, or when the leeches are inside, they'll still crawl back out. Trust me on this. You will see the leeches crawling out. And the reason is because when they're done, they're done. They're finished. They have to come out. There's no other way for them to go other than out. They can't go back further inside because it's closed. As I explained in the beginning, it's a shut door. The only way for them is to crawl back out. Once they do, they'll just drop on the floor. You will then collect them with the forceps. You will then put them inside cold water in a dark place, in a jar like this one, and then you will wait for them to digest the blood, or as much as they can digest it. Now, this woman claims to have put 500 leeches on herself. So you do the math. 500 divided by 3, 4, or 5. If it's 500 divided by 5, that's 100, right? That means the woman had at least 100 therapies done on herself. And if we separate the therapies once, say she had them done once a week, then do the math again. That's 100 weeks of therapy. Every month has 4 weeks, and 100 divided by 4, that's like what? You do the math. That'll tell you, if you divide 100 by 4, it'll tell you how many weeks So she had 25 weeks of therapy. 25 divided by 4, that's 6.25 months. So she had 6 months of constant leeching on her vagina in order to achieve these results. That's or over 6 months. It could be 5 months if she did it every 4 days. but it could be if she did it every week, it would be 6.25. And that's if she put 5 leeches on herself, on her vaginal lips. If she put less, like 3 leeches, then it would be even more, like 8 months. But I think she did mention in the beginning of this article that she did it for 8 months. So let me do the math. Okay, so I just wanted to show you. So the cervix apparently is the actual opening of the uterus. So yes, you can apply the leeches on the cervix. However, you cannot apply them inside the uterus. And I will show you what the cervix looks like. And it is that, it looks like a donut. And it's just got a little tiny little opening. And this is the view from the vagina. So this tiny little opening is responsible for letting the sperm pass through. And this right there is the uterus. And the cervix is at the base of it, so that's the donut. And then is the vaginal canal. So the cervix is like the gate to the uterus. And no leeches can pass through it, I can assure you of that. So, the woman had leech therapy at least for 6 months. She could have had it for 8 months. And each time she put between 3 and 5 leeches in herself, and she experienced amazing results. Now, of course, I don't recommend you do that at home by yourself, but if you are brave enough, you will do it no matter what I say. I'm not a medical doctor, it's not a medical advice, and please be sure to check out my links below for more informational videos, and to be able to subscribe and to be able to purchase your leeches. And I hope you enjoyed this presentation. Hopefully you learned something from it. If you have any questions whatsoever, be sure to comment below. I do answer all my questions. So until next time, bye from sunny London. See you next week.